Struggles of a social worker. My topic is about a social worker's life and what they go through in order to help people in need. I chose this topic because I plan on going to college to eventually become a social worker in mental health and substance abuse. Also, I had heard a lot of negativity about the field and wanted to educate myself on how to prevent the problems many social workers face. Social workers have to learn to separate their personal and professional life, or it will destroy them. The three areas I focused on were what social workers do for a living, how their job affects them, and how to prevent things such as burnout or personal distress. What they do. Social workers help individuals, families and groups regenerate or improve their ability to function properly in a social situation, as well as working to create societal conditions and give help and support to communities in need. There are many different kinds of social work, so what they do varies. For example, medical/public health social workers work with patients to ensure they are being cared for properly, facilitate communication between them and their caregivers, and assist with paperwork and decision-making. As a school social worker, your job is bridging children's personal lives and education to make sure their needs are being met. How it affects them. There are many different issues social workers encounter during their daily work lives. Some include personal distress, anxiety, secondary trauma, compassion fatigue, burnout and suicide. Issues they come across in order for these personal problems to occur include dishonest clients, children that want help but have parents who could honestly care less, people in other similar professions disagreeing or not caring for the client's needs, and personal client stories and flashbacks. Prevention against professional life disturbing personal life and who the social workers go to. It is highly suggested to keep one's work at work. Taking your work home is known to cause personal distress. That includes relationship problems, feeling no longer effective at work, depression, nightmares and more. Supervisors always leave their doors open for their fellow employees. They know what it's like, and their social workers need someone to talk to as much as the people who need to talk to them. Alliances with other professionals are always a great go-to. One is just as vulnerable as the others, and together their weaknesses become a group strength. Some of my research includes a British documentary television series Protecting Our Children about social workers in the Child Protection Department in Bristol, the Journal of Mental Health, and an interview with Jennifer Johnson, a school-based mental health specialist for Milford Junior High School. What I learned while doing this project was social work is a very easy job to mess up, but if one is truly passionate about it, they can work through the bad and become really great at it. Also, support systems are great while in this profession. In conclusion, social workers have it hard, but they work through a lot because they genuinely care for the clients they have. If it wasn't for them and the support groups that get them through the hard times, there would be a lot of unhappy people, with a lot of unanswered questions, seeking help. Thank you.